repeat, what supplements do our patient need after weight loss surgery?
That is an excellent question, Mary. Weight loss surgery, which is also called bariatric surgery, can be a valuable tool if lifestyle interventions or medications haven't been able to help patients reach their goal. But the aftercare following this surgery is very important, and if we don't manage this appropriately, it can put patients at risk of permanent damage to their bodies. Also, an increasing number of people are travelling overseas for these procedures, and I've noticed multiple troubling instances where important aspects of the post-op care have been missed from the discharge plans. To manage these patients in general practice, we need to understand two things. We first need to cover the types of surgery used, which we'll cover in part 1, and then we need to understand the supplements that are used post-op and how these surgeries can affect medications, which we'll cover in part 2. All types of bariatric surgery aim to restrict a person's ability to absorb nutrients. This creates a state of surgical malabsorption. This is achieved by altering the path of food through the gut, sometimes by making the stomach smaller or by bypassing parts of the small intestine. This malabsorptive state creates a nutritional deficit that's not a complication of the surgery, it's the goal of the surgery. This deficit can prove brilliantly effective for weight loss, with some patients losing 20 to 40% of their body weight. Alongside this, published data suggests that patients can expect up to a 72% chance of remission of type 2 diabetes, a 46% chance of resolution of hypertension, and a 70% chance of improvement in sleep apnea after their surgery. But sometimes the surgery can push the deficit too far, leading to malnutrition. This is prevented using vitamins and supplements which are started after the surgery and continued lifelong thereafter. This might feel a bit strange to continue a drug for life after an operation, but if someone were to have a leg amputation, they would have a lifelong need for a prosthesis or some kind of mobility support. And the need for nutritional support after bariatric surgery is very similar. The supplement regimes do differ depending on the type of surgery performed. The more effective procedures for weight loss create bigger nutritional deficits, which need more intensive supplement regimes. These surgeries can also affect a patient's medications, and each procedure has different implications for this. So let's take a look at the procedures in more detail. The least invasive is a gastric band procedure. This involves placing a silicone band around the stomach, which reduces its capacity and slows the passage of food through it. This makes you feel full more quickly, helping your body train itself to eat less overall. This procedure is quite easy to reverse, and other than the band needing to be tightened or slipping out of place, the risk of complications is quite low. A step up from this would be a sleeve gastrectomy. This involves removing about 80% of the stomach, leaving a tube-shaped stomach about the size and shape of a banana. By removing a portion of the stomach, this surgery has the advantage of reducing hunger hormones like ghrelin, whereas the gastric band procedure has no effect on these hormones. This surgery is irreversible and carries a higher risk of nutrient deficiencies, so requires more post-op supplements than a gastric band, and a higher risk of effects on other medications too. The most invasive procedure we see routinely is a gastric bypass, sometimes called a Roux-en-Y bypass. This involves creating a small pouch from the stomach and connecting the newly created pouch directly to the small intestine, bypassing a small portion of it in the process. This has a bigger effect on weight loss, but as expected, has a much bigger risk of nutrient deficiencies and effects on drug absorption. There is a procedure that can partially reverse this, but it is risky, and even if it's successful, the gut will never function the same as it did pre-surgery. There are other weight loss procedures out there, but these are encountered so rarely that it's not even really worth talking about them here. Instead, let's take a look at the supplements in the next video.